again.
The first thing we learn in audiology is how to look in someone's ear. This is an otoscope, and you just turn it on by pressing the green button down, and the little light turns on. But for this simulation, we won't need to because there's a light in there, and I'll explain more about that later. But to look in someone's ear, you pull up on the pinna, and you pull back. And for a child, you want to pull down and back. I pulled up a picture. This is an otosim, so it simulates what the inner ear will look like, and there's different pathologies as well. This is the middle outer middle ear. This is the ear canal. This is your tympanic membrane or eardrum. So yeah, for this, there's different pathologies and that we can choose from. Foreign bodies. And then that is just a piece of cotton from someone using a Q-tip, which you're technically not supposed to use, but because your ear self-cleans itself. Yeah, but for this one, for the simulation, you guys are just gonna put the tip of the otoscope in there, and then you can see, look down in it, you can see what we're all seeing on the screen, so it looks like you're actually looking into someone's ear. Any questions?
It always looks to me like audiologists hold that upside down from the way my doctor does. I wonder if you could talk about that. Like, are you guys told to hold it that way? My doctors may be old school.
Yeah, I think it's more preference.
Okay.
Like, I like to like brace it on the person's like side of their face, and
Okay.
so they can hold up, and then I switch and I do the other side.
Okay.
Teach that in nursing as well, and the reason that I was told is because it's kissing face if you don't. You're getting too close if you're holding it this way when you're looking into them.
Subtly mention that tonight.
Yeah.
Wow, you're really close. Interesting.
Yeah. So
And the
up and
pinna
back.
up and back for an adult, you said?
Yeah, and
But
then down and back for a child.
Okay.
Just because of the anatomy, and they're not fully developed and stuff. So,
okay.
and you always want to put a new clean tip on. All you gotta do is like twist it. It's pretty simple.
Okay.
Yeah.
Great.
I only brought one tip, but
That's okay for the simulation.
okay.
of it.
Cool.
Okay.
Yeah.
Good. So, which simulation did you want to run? Like, what do you want people to look for? Are you going to make it random, or what do you want to do?
We can just do random. I was just gonna. I mean, obviously I know a lot of people are not gonna know what each pathology is, but I figured something cool just to like look at, see if they
Okay.
can guess it.
Okay.
Yeah.
Well, if we've already got people who are doing this week, did you want to have somebody come up and do it? Okay. All right. Thanks, Sonia.
I don't know if you wanted to practice putting on the tip or not, but
You got it?
You said it already has a light.
yeah. So you don't need to put it on. So you just like try to stick it in there and then see if you can like see that up there.
Okay.
You should be able to see that, and then I'll switch to a different pathology.
That is cool. Is the tympanic membrane ruptured?
Squamous cell carcinoma of the external canal.
It does look like it has a hole in it too, though, but it doesn't. Cool.
Yeah, you have to like get it right in the spot, or else you gotta keep kind of fidgeting with it.
No, I mean,
Oh, she's changing it.
That's what I'm saying. How do you simulate a squamous cell carcinoma in a simulate? Like, is it a video?
It's like a USB is hooked up to this.
Okay.
Yeah. So.
So Sonia's seeing pretty much that.
Yeah, she's seeing this, and like you can, if you look in there, you can see the little cursor in there too, right?
Oh, yeah.
Yeah. iPad, so I can,
Okay, okay.
Oh, yeah.
so I can like
okay,
point
great.
to different things and.
So what else am I got?
I'm gonna look.
It's exciting. The ear canal's really small.
This is cool though. It's so tiny.
Picking on them.
It's really cool that there's a local TV inside of there. Not gonna lie. Slapping right ear, leading to a perforation. I didn't expect it to say a slapping right ear. And I was like, what is that?
Jen, can you move the cursor to where the
Oh,
perforation is?
Here's the perforation right there. And
Yeah.
I think there might be one right there as well.
So that should be a perforation in the tympanic membrane?
Yeah.
Yeah. Oh yeah, that's gonna give you some issues. Yeah.
I didn't know a slap was like.
No, some people,
Oh,
yeah, if
oh,
you like
right.
slap it, it produces a lot of pressure and then you can, yeah.
Gotcha.
Sorry. Do you wanna check it out? Yeah, do it.
UFC thing.
So upside down,
Yes.
up the back.
And more.
Just like really, I don't know, feel on
They want me into channel.
You can-
Oh, okay.
there. It's not a real
It's
human ear,
cartilage.
so you won't hurt
This
it.
isn't a person. There's a little yellow thing.
You see that right there?
I don't see a picture.
Was it today's notes? Yeah, it comes up.
Okay, this is a lot bigger than that. Yeah, I can't identify it. Just gotta
See
be honest
this
with
right
you.
here.
I don't even see your cursor. Look right here.
Go to the right.
Probably, I'll look at
Oh, the big red thing.
You see the cursor?
It needs to go to the other right.
Maybe the other right.
And you're gonna get red.
Okay,
You see it?
refer.
I guess you can just look on the screen.
Refer.
Right here. It's congenital osteoblastoma.
Need that specialist.
A what?
It's like a middle ear cyst.
Okay.
Jen, maybe we could hit just the normal ear too, just talk
Okay,
about
yeah.
the basic landmarks too.
Sure. Anyone else?
All right. Okay, so would we want to see this?
Yeah, this is a normal tympanic membrane. It's just our ear canal is very vascular, so a lot of times it's red, especially if someone uses a Q-tip or something, it just will make it irritated like pretty easily. But
I've never seen that like on a person, like on a patient before. Like not, well, maybe I think it looks more red like in here than it does on the screen.
there is another picture as well. This is also another normal.
There's usually a lot of earwax too.
Yes.
I don't see the conal light very well.
I think it's like upside down.
Yeah.
But this is one of the first bones, the malleus of the middle ear. Those are it's malleus incus and stapes. Those are the three tiniest bones in the body. And usually you'll see a conal light, so that tells you, if you see that, usually tells you it's like a healthy middle ear. But if there's like it's hard to see, usually it's like consistent with fluid or.
Yeah, I saw it better than the other picture. The
Yeah.
conal light.
right there, that's the cone blade. Yeah, this is the malleus. And the elbow.
Sounds a lot more dramatic.
Yeah. See if I can find earwax.
All right, let's get somebody from each profession. SLPs have already done it. But, okay, thank you.
The what? Yeah.
Ooh, that was some serious cerumen.
Veil.
This is just cerumen or earwax. Yes, most of that's like just dry skin. Yeah, some people, we can tell if you use Q-tips or not by how occluded it is. But also some people just produce a lot of wax as well. I always have a lot of dry skin in my ear. Yeah, we can take that out by either suctioning it, irrigation, or just taking a little curette, scooping it out, depending on how deep it is. But your facial nerve innervates right in the middle ear, so sometimes we'll get like, if we go too far, some people will cough or start gagging. I mean, that's if you're, they'll start gagging if you really are like deep in there, like messing with it, but.
Is that normally how far you put it in?
Yeah.
All right, nicely done. All right, we'll give you a good one.
Do you have to get like deep in there?
Yeah, I'm trying to go from there. So you see this more.
Oh, yeah.
This is exostosis. This is a lot of swimmers or like cold water swimmers or surfers. We see a lot in this. We don't know why, but it, being in cold water a lot produces these bony growths. They're benign, and if they usually don't bother anyone, but sometimes people can get like a conductive loss, hearing loss from it. So they can get them removed if they really need to.
Jen, is that the same thing as swimmer's ear, or is that something else?
Swimmer's ear is more like
That's just
yeah, like fluid and stuff. Yeah,
That
infection.
doesn't happen in like warm water surface, right?
So would you do anything for that? Is that just-
We don't really, you don't really, unless it's really bothering you and you can't sort of like have a big conductive loss, then you can get them removed, but because sometimes the removal of them can cause a hearing loss or, yeah, or damage to like the.
I have a question for you. Do you do the Weber and the Renee's test?
We don't really, but, yeah, we learned about it in class, but we really don't do that, it's like old school now, but. So we have like a bone oscillator that vibrates, so we can use that.
That's much more high tech.
Yeah.
You've got a tuning fork and everything?
Yeah.
we've never.
We were doing it this week, that's why.
All right. You could probably just use like that vibration motor in your phone or just like hold it.
True, but like, can you hear like more in this
Well, I
one?
bet there's an app that would like vibrate your phone at different frequencies and
Probably.
you could just do that.
Tyler, SLP. You're next.
You're gonna take the quiz. You're not gonna take the quiz. There's quite a long list here for it. Would someone have already come, or like, would you be the first person seeing a lot of these, Jen, or how does that work?
It depends. If we get a referral from an ENT, we're usually not. The ENT is usually the first one.
Right.
Or the physician. But some people, yeah, they come in and they just complain of a hearing loss, and then we'll end up finding that. So it all just depends if they saw their physician first or not.
Okay. Great. And so, do we have a nurse?
Yes.
We have a nurse. So, what kinds of things do you end up looking for when you do autopsy?
There's any like perforation or
Okay.
discernment, like if there's too much or
Okay. Okay.
like abnormals, I guess.
Okay. Okay. Okay.
And then you just refer.
Yeah, I guess like if it was concerning, you would either probably call audiology or just tell the doctor.
Okay.
And
Okay. And what kinds of things are you looking for? Or is it just you'd be learning about like all these things as well?
Definitely make sure that we can see in the external auditory canal, that we can visualize the tympanic
Okay.
do that, make sure that you can do that on both sides.
Tragus too.
Yeah, tragus.
Okay.
And then we document if there's wax in there or
Right.
redness.
Okay. Great. All right. So how does the simulated ear compare to doing this on a person? What do you think?
It definitely takes some getting used to.